Hi, everyone. It is time for your Wellness Wednesday tip of the week. Tonight, we're going to be talking about a condition that plagues 1 in 3 adults, or 84 million people, and that is type 2 diabetes. Type 2 diabetes is very common and is often considered a lifestyle disorder or a sugar disorder, right? It's caused by eating too much sugar. And 80% of the time, it does boil down to diet. Now, when it comes to sugar specifically, keep in mind, I'm not just talking about the white stuff that's on the table, right? It also includes all carbohydrates, which reduce down at the end of the day into sugar. So starchy vegetables, fruit, grains, for example. In other words, not all carbs are created equal. And honestly, that's a topic for a whole other conversation. So yes, sometimes sugar does have to do with it. However, what about that 20% that is independent of diet? So what about the people that are eating what most would consider a healthy diet, yet their doctors are still telling them that they're either pre-diabetic or diabetic? What's going on with those people? And trust me, in clinical practice, I've seen this several times. There are people that are eating a spotless diet, but they still have high fasting glucose, high triglycerides, high hemoglobin A1C, and all of the markers for diabetes. What's going on there? So in this case, that's because diabetes can also be caused by other things other than sugar. We have to look at what else is affecting the metabolic machinery. So for example, hormone imbalance, inflammation caused by like intestinal gut dysbiosis or an underlying infection, or toxicity potentially caused by, toxicity is kind of everywhere. It's in the water we drink, the food we eat, the air we breathe, unfortunately, heavy metal toxicity. All of these factors have the ability to adversely affect the sensitivity of the cells to insulin, A. B, adversely affect the cell's ability to utilize glucose once it gets into the cell. So this will the end result is that it mimics diabetes, right? It mimics type 2 diabetes, but it's a completely different approach to restoring balance and getting blood sugar back under control. So I bring that to your awareness, and I hope this is helpful for anybody that has, they've been battling diabetes, trying to just count carbohydrates, which I can tell you right now is never gonna work. First of all, it's not sustainable. Second of all, like I said, oftentimes carbs are created different, so everything's unique. And then sometimes it's not even a problem with carbs. So if you're battling diabetes, trying to count carbs, trying to reduce your sugar, and nothing's working, keep in mind there might be something else there. And I encourage you to seek help if that's the case, and seek someone that can help you figure out and put together all of the pieces of your healthcare puzzle. So hope that was helpful. Hope that was informational. Please disregard the chaos that's going on behind me with 2 dogs, but they always keep things interesting. So that is your tip of the week, and stay tuned. I look forward to meeting with you next week for another health, wellness, mindset tip. Have a great night.